and on TuneIn, iHeart, and on Odyssey. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy, and we got lots of questions about what Chicago's going to look like still yet this summer, much less into the fall when school restarts. To help us with those questions and the answers to them, Dr. Allison Arwady joins us. She is the commissioner of the Chicago Department of Public Health. Dr. Arwady, thanks for joining us. Appreciate it.
Of course. Good morning.
Good morning. So why is the Air and Water Show canceled again?
So there's a modified version of the Air and Water Show that is moving forward. Obviously, it's been a hard year for everybody economically, and we felt like it was important to make sure that there was an opportunity for people to gather and celebrate, but there needed to be some modifications.
But, I mean, there's 40,000 people at Wrigley Field. Why does it matter how many people are at the lakefront?
So I would say one thing about where you're in Wrigley Field or you're in settings where people have tickets and they're sitting in one place, we do see some differences there between when people are not having a dedicated place to stay. But the point is, outside remain safer than inside. But things like the Air and Water Show do get planned many, many months in advance. We're certainly hopeful that by the time we get to the Air and Water Show, we'll be in just as good shape as we are right now from COVID. But we'll get there if we keep making good progress on vaccination.
So it's more of a logistics problem than anything else?
Well, I would say broadly, we're really working to make this summer as close to what we were seeing in 2019 as possible. But nobody knows for sure what the future holds when it comes to COVID-19, and we're still not where we need to be on vaccination. So especially for really large, expensive events, there still are some limitations in place. But, broadly speaking, a lot of things are moving ahead, especially where there are still some safety precautions in place. And if we keep making progress, my hope is that by, much later this year, we won't even have to be thinking about COVID. But that all depends on people getting vaccinated.
Well, let's talk about the vaccination. What is the vaccination rate so far in Chicago? And are the unvaccinated Chicagoans at risk?
So right now in Chicago, about 54% of all Chicagoans have gotten at least a first dose of vaccine, and about 47% are completely vaccinated, meaning they've gotten both doses of the two-dose vaccine. If you just limit it to adults, it goes up to about 65%. And what we've seen is that really since January, when the first time you could be fully vaccinated against COVID, here in Chicago, 97% of the people hospitalized with COVID and 98% of the people who have died from COVID are people who have not been fully vaccinated. So we've seen, each month as more and more people are vaccinated, where COVID is landing, it's landing in unvaccinated neighborhoods and especially social networks in Chicago. So right now, the risk is less than it ever has been because our numbers are looking good and the vaccine level is, much better than it's been. But for people who are unvaccinated, my concern is if we see some seasonality to this, if we see the fall and the winter, COVID resurging like flu and colds do, where that would land would be in people who are unvaccinated.
Do you see that this can be a bit confusing? Because on the one hand, you talk about outdoor events like the Air and Water Show, and you're sort of giving us the out of an abundance of caution, worst case scenario. We don't know what's going to happen. Of course, nobody knows what's going to happen. But are we planning for what the most likely outcome is or what the anything is possible under the sun outcome is going to be? And with respect to events like that, it seems to be the anything under the sun possibility. But when it comes to finally starting to relax mask mandates and other strictures, but yet still not wanting to be where not where you want to be with vaccinations, you say, well, we still have issues. We're not where we want to be, but we're still going to move forward with reopening because we need to. And that seems to be a more pragmatic, like, hey, we got to, balance some things here. So and sometimes there's a balancing and other times there's not a balancing. I think that confuses people.
Sure. So this has been a balancing act all along. Let me tell you where I land on this. The two things that I'm the most interested in when we're making these high-level decisions are, number one, is there a threat to our healthcare system? Right now, there is not a threat to our healthcare system. We still do have lots of people, hospitalized with COVID. We're still averaging about 3 deaths every day here in Chicago, but it is in no way at risk for overwhelming the healthcare system. And number two, do we have a widely available vaccine vaccine, something that can, people can make that decision and protect themselves. And those two things are true in a way that they were not months ago. And that's why we have relaxed really all restrictions except in places like public transportation, in places like healthcare settings where masks remain required. But we absolutely will continue to see events and settings make decisions that make sense for them. And I wish I could say COVID was over, but we know looking globally that it's not. And it's important to make sure that we continue to be prepared for if we do see, a new variant emerge that the vaccines are not protective against, if we do see a resurgence in the fall or winter. But right now, things are open in Chicago. That's appropriate because COVID is in the best control that it's been. And I primarily am interested in making sure people have the right information about getting vaccinated, because if you're vaccinated, really your risk for COVID is almost nothing, especially when COVID is in control broadly across society. So that's really the balancing act that we're playing, but it's why we're at a point, we were the first, the largest big city to open quickly, and that's because Chicago has broadly done a good job in terms of controlling COVID.
Well, the Delta variant is the big, buzzword right now. I know it's in 46 states. Is it here in Chicago, and is that what parents should fear the most if they don't have their kids vaccinated?
So it is here in Chicago. We've had at least 15 cases of it diagnosed right here in Chicago, but we've had every variant to date, already diagnosed here in Chicago. And the good news is that all of the vaccines that are authorized for use here in the U.S., all three of them, do remain protective against the variants. They're not quite as protective. So like with the Delta variant, it's a little more contagious. It can potentially make people more sick, and the vaccine goes from that really high, 95% protection. It may drop to the 80-something% protection range. But the good news is the vaccines are still working. And so the fact that we are seeing this progress, even with variants here, gives me hope as long as people keep getting vaccinated. So I prefer people to make that decision for vaccination, not out of fear, but out of a proactive decision to protect themselves and their families and certainly their kids. I have encouraged, everybody I know over 12 to certainly get vaccinated, because then you don't have to worry about the Delta or any of these other variants right at this point. But we don't know what's going to happen. And as long as a lot of the world and even a lot of the U.S. is not vaccinated, my concern is we could see a new variant emerge in the future where the vaccine would not be protective.
So you're encouraging K through 12 students to get vaccinated. Martin Kulldorff, who's at Harvard Medical School, Jay Bhattacharya, who's Stanford, argue that it's ill-advised to push vaccination on the young. Basically say that all medical intervention should pass the test of providing more benefits than risk for the COVID vaccine. It's true for older populations, but it is not yet clear for younger people. The mortality risk is extremely low, so even a slight risk of an adverse reaction could tip the benefit-risk calculation against getting vaccinated if you're, under the age of 18. So how do you respond to that?
So certainly our highest concern is people who are over 65 in terms of getting vaccinated. We're still only at about 70% of those over 65 have gotten a first dose here in Chicago. That's not great compared to the country. And you're right that those are the people who are the most likely to, be hospitalized or die. That said, the risk-benefit calculation is absolutely the one that we take into account when we're making recommendations for vaccine, including for children. And although most children don't have a serious infection from COVID, we certainly have seen some that have, and we've seen kids hospitalized, even a few that have died, including here in Chicago. And the vaccine has not been shown to have risk factors. In fact, when kids do get COVID, they're more likely to have some of the serious outcomes that we've been monitoring. And so the vaccine has undergone all of the same safety evaluations that all other childhood and adult vaccines go through. Yeah. And really, I am much more confident with the vaccine than with taking the chances for COVID, and especially where we've seen some of the, inflammatory and other potential long-term effects. They're not likely, but they're certainly more likely than having a bad effect from a COVID vaccine.
But so Dr. Sarah Ross, who's the chief of pediatric critical care at Tufts Children's Hospital in Boston, said of this 12-year-old girl that came in with myocarditis after taking the Pfizer vaccine, and again, after, so I'm not determining causation, I'm just saying this is the progression. She said that I've practiced pediatric ICU for almost 15 years. I've never taken care of a single patient with a vaccine-related complication until now. Our standard of safety seems to be different for all of the other vaccines we expose children to. Dr. Sarah Ross, not an anti-vaxxer, obviously. And so that's, these are anecdotes that speak to a larger issue. And you say you do the cost-benefit analysis for the young, and CPS is going to be hanging on your every word in terms of what they effectively mandate come the school year. And yet, what are the numbers? Where's the science? Where's the studies on this? Because I hear you saying you're doing it, but I don't hear you saying how it tips the scale so obviously towards the vaccine for the young kids.
Sure. So myocarditis, which means inflammation, around the heart, is something that can come from a whole range of things, including viral illnesses. And so, in fact, the rate of myocarditis, of this inflammation, is actually higher with COVID at this point, where it's been looked at, even in young children, than it has been with the vaccine. It certainly is something that that the CDC and scientists across the country continue to monitor. But there has not been at this point, certainly, a risk associated with this vaccine that outweighs the benefit, because the American College for Pediatrics continues strongly to recommend this vaccine for everyone over the age of 12. Certainly, if people have questions or concerns, I encourage you to talk to your pediatrician. They can look at your patient, your child's health, and have that discussion with you. But when we look at the recommendations, pediatricians across this country are recommending this vaccine for kids, and that is looking at all of the data. There are anecdotes, and I know that can be scary for people, but where we look at this at a population level, I'll tell you, this is something that I'm absolutely, all the kids I know have been vaccinated at this point. And if there are some that haven't, I'm often talking to their parents, about that decision. And I do make that recommendation for kids I love based on looking at the data myself.
And when you look back at the last year, is there anything you would have done differently? And what about criticism that you received pretty much on a national level for dressing up as the Rona Busters with Mayor Lightfoot?
Are you kidding? So I think anything that brought attention to the coronavirus really has been a way to get people talking about it here in Chicago. I think, there were a lot of Halloween costumes related to coronavirus this year. And I think, there is nothing that I have done for this last year and a half except be focused on trying to, bust coronavirus and have it be as controlled as it has been here in Chicago.
And you were one of the first person that I heard say we need to get kids back in school.
Yep.
So we appreciate, and I hope in the school that they'll be unmasked and that we're not testing healthy children at school. Why not at a doctor's office?
So one of the things is that I think, there's going to continue to be lots of conversation about vaccine. We know that there's not vaccine available yet for younger children, right? I expect probably sometime this fall the studies will be done, and I anticipate once they've sorted out the appropriate dosing and checked everything, I do anticipate that there will be the safe vaccine available for kids under 12, but it's not yet. And in that setting, certainly the opportunity to have testing available, not just kids, but for adults, who have not been able to get vaccinated or have chosen not to get vaccinated, is one of the ways that we can help keep, all of these settings safe for everybody. I'm a huge advocate for in-person school education, and I'm excited about the fact we'll be in a place that is going to be possible this fall. But I do know there's a wide range of opinions there. We're not talking about the deep, sometimes people call it the brain biopsy, where you're sticking the Q-tip far back into the nose, but there is widely available testing now, and in settings where vaccine isn't possible, we felt like it was important to make this widely available for staff and then potentially for kids, where that decision is made.
Dr. Allison Arwady, she is the Commissioner of the Chicago Department of Public Health. Dr. Arwady, thanks for joining us. Appreciate it.
Thank you. Appreciate it.
Thank you, and we hope to have you back. And she joined us on our turnkey.pro answer line.
Listen to podcasts of Dan and Amy from the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
The IRS is giving away billions of dollars in tax savings through a federal program called the Fresh Start Initiative to aid delinquent taxpayers. This initiative was established for anyone facing financial hardship and unable to pay their back taxes. Qualifying and enrolling in this program will stop all collections, settle your delinquent tax problem, and even reduce what you owe by thousands of dollars. Call the hotline at People's Tax Relief to see if you qualify and get this free information by dialing 800-351-4596. If you have unfiled tax returns or cannot afford to pay your personal or business back taxes, you can now get the help